over $100,000. That's how much your billing and coding errors are costing your practice per doctor every year. In a world of expanding CMS audits, AI-driven reviews, mixed penalties reaching as high as 9%, CODER is here for you, the frontline optometrist. Macular degeneration affects around 20 million individuals in the United States. Over 18 million of those have early macular degeneration, which proves that macular degeneration is really an optometric disease, and we can be managing the vast majority of these patients. Now, once they get neovascularization or geographic atrophy, then we can refer them to our retinal colleagues, and then it becomes an ophthalmologic disease. There are several things that affect the risk of developing macular degeneration. The number one is smoking. Smoking robs the body of antioxidants, which can contribute to the formation of drusenoid activity. Genetics certainly plays a role in macular degeneration, and also lifestyle. Lifestyle plays a major role, including the type of diet that you have. Studies have found that the Mediterranean diet can be extremely helpful due to the high level of carotenoids and omega-3 fatty acids. Other risk factors include a high level of saturated fats, obesity, and hypertension. The three stages of macular degeneration include early, intermediate, and severe macular degeneration. Today, we're just going to be talking about early and intermediate. When we talk about early macular degeneration, we're talking about drusen less than 125 microns. So what do we recommend for our patients at the early stage? According to the American Academy of Ophthalmology guidelines, there's no recommendation to be made at that stage other than lifestyle changes like we mentioned before. So no specific supplementation. This is considered controversial, and there are many practitioners who feel that supplementation with carotenoids and omega-3 fatty acids may be helpful. So we follow these early age-related macular degeneration patients for years. At what point do they move into the intermediate category? The one thing that differentiates between early and intermediate macular degeneration is the size of the drusen. And once you hit a druse at least 125 microns, that then puts them into the intermediate category, which is significant because at that point we now recommend the AREDS 2 vitamin, which has shown a 25% reduction in the conversion of a patient into the severe category. Also, once you hit the intermediate category, your chance of progressing into the severe category is up to 50% within the next 5 years. So how do we determine what level of macular degeneration they're at? Because we know the three classifications are early, intermediate, and severe. So we use our procedure codes, including 92250 retinal photography and 92134 MAC OCT. So the real differentiator between early and intermediate macular degeneration is how big are the drusen. And if they're less than 125 microns, then it is early. If it's greater than 125 microns, then it's intermediate. And we can use either our MAC OCT or our Fundus Photography to determine that. When we look at macular OCT 92134, we can actually use our calipers to measure how many microns the drusen are. And the other way with using retinal photography is we can look at one of the vessels coming off of the optic nerve. And those vessels are typically right around 125 microns. So if the druse is larger than one of those vessels, then we know it's intermediate drusen. But why is that even important, determining whether it's early or intermediate? It's because if it's early, the AAO practice patterns say there's no supplementation supplementation for those particular patients. However, if they hit intermediate, then we give them the AREDS vitamin, which then reduces the risk of progressing to the severe stage. So that's how we use both retinal photography procedure code and MAC OCT procedure code to determine what level they're at. Thanks for watching OD Coder. Remember, like and subscribe.